I'm curious because you describe a socially toxic environment in your book, Lost Boys, and we will talk boys and girls as we go through the program. But this socially toxic environment sounds like it also includes a professional community that's not quite responding to the child, but again, responding to some very narrowly focused training. Have you thought about it that way?
Well, I do a bit, because most of my professional life has been geared to getting professionals out of their boxes,
yes,
so to speak. I think public health, tells us that the quality of life and the quality of development for an individual depends a lot on what the environment around them offers, how healthy or how poisonous it is. We know physically toxic environments, lead, PCBs, so have an effect on developing children, but the social poisons, the cultural poisons also. And the other thing that we have to remember is that the most vulnerable children soak up those poisons and are most affected. That's true in physical toxicity. Asthmatic children are most at risk if you have air pollution. And psychologically vulnerable or psychologically asthmatic children are most vulnerable to social poisons. And I think not enough professionals have really understood that to do their job as a professional with one child, inescapably they've got to do their job as a citizen, as a community leader, as a kind of a social public health person.
Are there some specific things you'd like to see happen in communities to reduce the toxicity?
Well, I think one thing is a kind of inventory, more of an inventorying of what is going on. I think all too often too much responsibility is left on the parents. I think professionals should do a better job of organizing parents to make their job easier, as they have done in the public health physical field. I mean, if we, you could ask how many parents have to worry about their kids getting cholera because they're monitoring the water that comes out of their tap. Well, obviously, we say that's a community responsibility. But we talk about monitoring what comes over the airwaves, what comes through the video games, what the cultural poisons are. We say that's a parental responsibility. And I think professionals haven't done enough to take on that responsibility and organize parents and be a leadership force.
In some ways I think there is a bit of a change such that parents and professionals are beginning to take this issue on. But that socially toxic environment affecting the most vulnerable individuals seems to indicate that for the early part, at least of the youth violence epidemic, it was urban, poor, adolescents, minority males, and we didn't take on the socially toxic environment issue when the epidemic seemed to be isolated there. So we owe an apology, I think, as we begin to talk about this, for ignoring so much for so long. I think the good news is now that this youth violence epidemic is affecting girls and middle-class America, small-town America, we're willing to take that on. Do you run into that?
Well, I run into it sort of all the time. I remember a very poignant moment at a conference shortly after the Littleton Columbine shootings, where a panel was presenting. They were guidance counselor, school psychologist, principal, all from predominantly white middle-class schools who had school shootings. And they talked about how traumatized they were and how awful it was, and the trauma continued. And then an inner-city professional stood up and said, I feel for your loss, but understand that this is what we've been dealing with day in, day out for decades now. And I think it is an opportunity to bring people together around this issue, but it does require acknowledging that the issues of race and class blinded us to a lot of this for a long time.